everyone. I will introduce you to our client, John Thomas. He is an 80-year-old retired farmer who has been experiencing significant memory challenges. Over the past 2 years, John has shown increasing signs of forgetfulness, confusion, and difficulties in performing daily activities. He often repeats questions and misplaces items, which has caused concern for his wife. Recognizing these challenges, she brought him to a memory clinic for evaluation, and he has been diagnosed with Alzheimer's disease, which is a condition that affects the cognitive function and memory. So this diagnosis helps us to give insight to the life of Mr. John, and let's discuss about the pathophysiology and pharmacological interventions for his disease, which is Alzheimer's disease. So let's have a discuss about the pathophysiology of Alzheimer's disease. What is Alzheimer's disease? It is a common type of dementia characterized by the presence of extracellular amyloid beta plaques, intracellular hyperphosphorylation of tau protein, and neurodegenerative with cognitive decline. So, what part of the brain is affected by Alzheimer's disease? The main part that is affected by the Alzheimer's disease is hippocampus and amygdala. Let's discuss about the hippocampus. Alzheimer's disease has a significant impact on hippocampus, which is a crucial part of the brain involved in forming new memories and responsible for converting short memories into the long-term memories. So, Alzheimer's disease affects hippocampus by shrinking the hippocampus, also known as hippocampus atrophy, and then followed by the loss of neurons, accumulation of abnormal tau proteins, forming tangles, overall affecting the memory and cognitive functions. So, amygdala. How does Alzheimer's disease affects amygdala? Amygdala is a part of brain responsible for the control of emotions. Just as hippocampus, amygdala undergoes atrophy, leading to aggressive behavior and hugely impacts the person's behavioral response. Alzheimer's disease patients often experience significant changes in mood and behavior as the disease progresses. So let's discuss about the significance of amyloid B plaques and neurofibrillary tangles in Alzheimer's disease. On the screen you can see amyloid B plaques in an Alzheimer's disease brain. As we can see, the healthy brain do not have any plaques, and we can see the normal neuron, whereas in Alzheimer's disease we can see that there is amyloid plaques present. So amyloid plaques are abnormal clumps of beta amyloid protein that accumulate outside neurons. So how does it contribute to the clinical manifestation of dementia? These plaques disrupt cell-to-cell communication and activate the immune response that lead to the inflammation and cell death. So this contribute to memory loss, and as the affected neurons cannot process and store information. So let's discuss about how neurofibrillary tangles contribute to Alzheimer's disease. These are twisted fibers are found inside the brain cells in areas like cortex, hippocampus, and amygdala. So how does it contribute to Alzheimer's disease? These tangles disrupt the transport system within the neurons, leading to cell death. This results in breakdown of neural networks essential for memory, reasoning, and other cognitive functions, manifesting as confusion, disorientation, and impaired judgment. So, doctor can diagnose Alzheimer's disease by finding enough neurofibrillary tangles and amyloid beta plaques in the brain, usually through a biopsy or after death. So there are no accurate cure for Alzheimer's disease, but there are medicine to help improve the symptoms and prevent deterioration, such as cholinesterase inhibitors. The examples are donepezil, rivastigmine, and galantamine. Let's discuss about donepezil. It is an acetylcholinesterase inhibitor, which means that the decreased breakdown of acetylcholine, reducing the apparent deficiency of cholinergic neurotransmitter activity in Alzheimer's disease. There are lots of side effects and precaution for the donepezil, such as nausea, vomiting, diarrhea, abdominal pain, and anyone having GI or uterine obstruction, pregnant, asthma, and Parkinson's disease should avoid this medication. So, what are the nursing considerations for donepezil in the case of Mr. John? We need to consider patient medical history and the age are one of the important factors. We need to monitor for any signs of gastrointestinal distress, administer with food to minimize GI upset. We need to carry out the assessment like collecting data and assessing the patient's mood, hygiene, appearance, or movement. And donepezil may increase liver enzyme levels, so we need to monitor for liver function. Proper education about the medicine should be given to the caretaker in case of Mr. John, which is his wife.